As the world battled COVID-19, Kenya's story came down to a fight to trace positive cases, a battle to save doctors' lives, and a face-off with Kenya's long-standing enemy, corruption. I walked this journey both as a medic and a journalist, a journey of anxiety, uncertainty, and hope, even when it looked impossible. As Kenya plans to administer its first doses of COVID-19 vaccines, I'll take you behind the press conferences. Afya House, the headquarters of the Ministry of Health in Kenya, was the nerve center to what was going on with those battling the disease as patients.
I consider ICU to be like, that edge of the cliff.
And as medics.
This room, we use it for storing personal effects from patients.
And some as the policymakers.
Coordination between the national and the county level through the Council of Governors has always been not easy, has been a little bit difficult to implement.
My name is Dr Mercy Korir. This was a homecoming like no other. These young ones, happy to have Papa back, may not fully grasp the significance of this small ceremony. This was the evening after Moses Njagi had been discharged from hospital.
I woke up very early in that. I think that night I didn't sleep, honestly.
For a whole week, he was fighting for his life. At some point, his family was ready to plan a funeral.
Everybody that I called, from my dad, my wife, of course, and generally, especially the family, everybody was like crying, We could not even communicate for a minute. Admittedly, one of my cousins told me there was that fear that they had lost me.
Moses Njagi was my colleague in the newsroom, working at the time as a senior reporter at the Standard newspaper. He has spent years telling his story, but now he is the story.
I consider ICU to be like, that edge of the cliff.
One morning in July, I got a number of calls from colleagues about his admission at an intensive care unit.
I would ask the nurses, how is he doing? They're telling me, no, he's still very critical. He's still very critical.
Temperatures were okay, and I had all the sense of smell and everything else. I think that could have indicated that I had COVID-19. There was nothing to show.
He had a 5-day battle in which he cheated death. What started as a cough, which he had tried to treat with over-the-counter medicines, landed him in ICU after trying to isolate at home for 3 days. His wife, Immaculate Njagi, a teacher in Nairobi, did not anticipate what lay ahead. It would be days of anxiety and many sleepless nights, crying her heart out and praying that COVID does not rob her or the father of her 2 children. It is at MP Shah Hospital that he would lose track of 5 days of his life. Within those 5 days, his immediate family lost hope and a life without him.
The time that I woke up, I thought it was, the following day. I woke up and there were these lights. So I was like, oh, I'm alive. On whichever divide that I was, at least I knew that I was wherever. I even tried pinching myself. I got confused. So I actually just called and I asked my wife. I thought I was dead and resurrected.
While this was going through his mind, he also feared that he had infected his family. And according to the promises by the government, he was hoping that an officer from the Ministry of Health had done the appropriate contact tracing and testing.
Some contacts now from the Ministry of Health called to get details of my family for that contact tracing, so that they wanted to now to come and have my family tested and so on. So I gave them the details, and even at the point at which I was going to the hospital, at that point, 4 days later, they had not come. No one had talked to us again about being tested. So actually, it took my wife. Actually, she did it on her own volition now too, and went for her own testing.
In 2017, a far deadlier disease had hit Kenya. Some restaurants were shut down. Catering events were viewed with suspicion. People dying in hospital. And Kenya's response was to deploy one of its most important assets, the community health worker. Rose Mbithe was one of them.
Wakati kunapokuwa na cholera outbreak, huwa sisi tuna create awareness kwa community, tunawaambia dalili za hiyo cholera. Wakati mtu anapoona dalili kwa jirani yake, hata yeye mwenyewe na kwa familia yake, ama anybody kwa kijiji, wanamkimbiza hospitali. Hivyo hata bado kwa mambo ya COVID, hivyo ndio tuna create awareness.
Kenya's COVID-19 was no different from Mbithe and her colleagues.
Once mnapopoteza mtu mmoja, majukumu ya huyo caregiver mumeachiwa nyinyi.
In the year 2017, Kenya had 3,697 cases of cholera. Among these were 76 deaths, giving a case fatality rate of 2%. At the time, 20 out of the 47 counties had reported cases. Nairobi continued to have active outbreaks, one because of community transmission, institutions, and event gatherings. The government set up a national task force to respond to these outbreaks, and this included surveillance, case mobilization, and case management. Does this sound familiar when you think about COVID?
First case of coronavirus, a 27-year-old black Kenyan female citizen who came into the country on the 5th of March from Ohio in the United States via London.
The woman is currently at an isolation ward in Kenyatta National Hospital and is said to be in a stable condition.
Fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
This officially marked the beginning of Kenya's COVID-19 story. The pandemic is bearing down on Kenya's borders, and a task force with the institutional memory from cholera outbreaks just 2 years ago has a game plan that could work. The World Health Organization, represented by its Kenya country representative, Dr. Rudy Eggers, would help the country prepare.
In the start of this epidemic, the EOC was able to actually manage it all from Nairobi. They were able to phone counties and get the information almost on an individual basis. But of course, as numbers increased, that responsibility was something that really the counties had to take over. And that was quite varied.
The response for such a public health emergency would involve identifying cases through active search and testing, isolation and quarantine, and treatment of those who are asymptomatic. Such an exercise requires boots on the ground. Rose Mbithe and other community health workers and medics would be the game changer, especially as the situation gets worse.
But I think the ability to actually follow through on the contact tracing has been a huge issue here in Kenya, and could have been done a lot better.
Contact tracing, an integral part of the pandemic containment, had started failing midway through the year. The ministry's own reports indicated that people were either giving false details or not picking phone calls from the health officials. The melodrama that Kenyans had been exposed to at the initial period of contact tracing had faded.
It was a period where the government decided to have everybody that tested positive isolated in a government facility. And only once that became problematic due to the numbers, they moved to the home-based quarantine that we have now.
There were no more ambulances, no armed police, no personnel in hazmat suits whisking people away from their houses to be confined in hospital isolation centers. This had failed for mundane reasons, like ambulances not being fueled. Some politicians and those with money were looking for options to save themselves and their immediate families should they be struck by COVID-19. They were seeking out doctors to set up intensive care units in their homes.
I was once approached, I think it should be like 2 months into the pandemic when the numbers started rising, by one of the wealthy families around, that they wanted to set up a private ICU that could be able to sort out any members of their family and probably even to use it to help other influential individuals who may not get access to ICU care, because there was this fear that we are going to get into a situation where there'll be no ICU beds available.
They learned the hard way that ICU care was not just a matter of a bed and oxygen tanks.
The dynamics about running an ICU are so much different that it's really difficult to feel like you're able to have an ICU bed in a house, because the staffing itself needs round-the-clock staffing in terms of both nursing care and critical care. You need physiotherapy, you need a working. People who have influence on the public know that ICU care is basically just not having a bed. It's a whole system in itself, and the best thing would be to equip hospitals to be able to run ICUs, because ICUs need a lot of support from other departments within the hospital setup. They need lots.
Rwanda has been testing to the extent 3-4 times the amount that Kenya has, and has done so consistently across the period involved. So whereas in Kenya we saw a peak of testing at the end of July, and now it's less than half of that, in Rwanda that has been maintained really. So I think the ability of the Ugandan government to know where the cases are, and then the second part is to trace the contacts of those cases, has been much more consistently done. In Kenya, both the lab testing declined just recently, and of course the contact tracing also has been quite limited in the last couple of weeks really. Initially we had a lot of the counties really doing contact tracing, and that's really shrunk to just a handful of counties.
So this would be another typical day going to cover the press conference at Afya House. I would come in ready with my questions all prepared depending on the topic that we're having a conversation on. And the questions were mainly things that I thought were not being adequately answered by the Ministry of Health, and the questions that were bugging the citizenry. People who are wondering what is happening, especially around the time of quarantine and isolation, and there was a lot of uncertainties about what was happening, what the government was actually doing. And I remember one of the things that really bothered me and bothered a lot of people was when the Ministry of Health extended the duration of quarantine after the first 14 days because in the quarantine center somebody had been diagnosed with COVID-19. And this really bothered me because I could not understand the science behind that particular decision. The other one was on PPEs, that the government kept saying, you know, we have adequate PPEs, some are in transit, they are coming. But when you talk to the healthcare workers on the ground in various parts of the country, and even in the isolation units, they did not have adequate PPEs. Doctors were fundraising to get their own PPEs. People were worried that they would contract the virus.
Though this is a painful measure for those whose duration of quarantine has been extended, it is a painful measure that we had to take, but it is for the good of the Kenyan people.
Afya House, the headquarters of the Ministry of Health in Kenya, was the nerve center of the COVID-19 response in the country. Every afternoon at about 3 p.m. or so, the Cabinet Secretary would, before the Fourth Estate, inform the country of how it was faring on in terms of its COVID-19 response, give the numbers and issue new or any other protocols and measures in an effort to contain the pandemic.
The disease has now been classified as a pandemic. I have, as Minister for Health, invoked the Public Health Act.
This daily update on numbers, on who had turned positive and their location, was not enough. The many orders issued to the public to follow in a bid to contain the virus needed to make sense. After about a week or two, I felt like these press conferences were not really answering the pertinent issues that are not just bothering me personally, but also our audiences, our readers, our viewers, and our listeners in regards to the COVID-19 response. Is there a consignment of PPEs coming into the country? And if so, when? Is it at the end of this week? What is the breakdown of these PPEs in terms of gloves, face shields or goggles, if any, and the coveralls? What is the distribution plan by the Ministry of Health to the counties and by extension to the healthcare workers, and by what timelines? And lastly on that, are there additional plans to increase PPEs to the healthcare workers, and these plans in terms of amount or the number of PPEs, and what timelines are there? Second, on these healthcare workers, particularly those working in the high-risk areas, that is the isolation centers, is there any reason, public health or otherwise, why they are not in separate accommodation instead of them leaving their workplaces, getting into the same matatus and pikipikis like the rest of us, and going back to their homes where they may carry whatever virus they have picked from the healthcare workers? The last one is a request to you and your team that when you do your daily addresses, you can break down the numbers for us in terms of not just the new numbers, but in terms of the severity of illness, in terms of those that are mild, those that are in critical condition, and the age groups of the people who've been affected by the coronavirus.
The issue of the personal protective, the PPEs, we will not be needing. Nobody is going to lack PPEs in the next 2 weeks. I can tell you that. We have already got consignments for theater PPEs. We have got, this week alone, we have got an addition of about 10,000 kits this week. By the end of the next 7 days, we expect to roll out about 200,000 kits.
The coordination between the national and the county level through the Council of Governors has always been not easy, has been a little bit difficult to implement. We recognise that in Kenya, of course, you have 48 governments. You've got the 47 county governments with the national governments, certainly for health on an equal footing, and bringing together in a unified force that amount of power is quite difficult. But that has been frustrating. It would have been helpful actually if there was a much more joint approach between counties and the national government.
As the COVID-19 response coordination starts grinding to a halt, patients like Moses are gasping for air. His lungs and kidneys got a beating from the infection. His condition at the time was at 50-50. The doctors could not assure Immaculate that he would walk back home.
Fear of leaving and having my children to stay without a father, to live without a father, without the breadwinner. It was worrying. It was getting me so worried. I tried telling the doctor to allow me to make that last call.
Meanwhile, Health workers are flagging a lack of personal protective equipment. Corruption had infiltrated a pandemic response. Money for PPEs cannot be accounted for. This will have devastating consequences for people caring for the sick, like Moses. A 28-year-old young doctor and father lost his life to COVID-19. Dr. Stephen Mogusu's last words to his fellow doctors after working for 5 months unpaid by government was for them to, and I quote, "Get your pay and get out with your health or life intact." This he said on his deathbed, weak as he begged for one more gasp of fresh air. Today I just want to say, save your miserable selves from those institutions you live to earn again, he said. More than 3,000 healthcare workers and counting have contracted the virus. Tens others have died, among them 16 doctors, majority of whom were specialists with many years of experience in their own fields. 2 months prior to Dr. Mogusu's death in December,
we need to be given comprehensive healthcare cover.
As leaders hold political gatherings, a worrying trend is emerging: the breach of COVID-19 containment measures.
a sharp increase in COVID-19 cases was reported in areas that were involved in political rallies. Kisumu, Kisii, Nyeri, Embu and Kakamega counties had been of major interest to politicians. Between October 24th to November 2nd, Kisumu County recorded 214 new infections, while Kakamega County had 146. Kisii had seen a sharp rise in 110 new cases, while Embu had 34, Nyeri 37 new infections. What all these counties had in common was being hosts to some major political gatherings by top politicians who drew in crowds. The personnel at the isolation and treatment units were learning how to deal with this new disease and the surge in numbers. This visit was in October 2020, 7 months after the first case was declared. The ward is less crowded and only the very sick in need of medical attention are admitted. This lady from Gong is hoping that her breathing will get better soon.
This room, we use it for storing personal effects from patients.
These are patients who lost the battle to the virus. Some relatives, Andrew says, do not come back to pick these items unless they are valuables like money, jewelry or watches, probably not wanting any reminders of such a loss to a family. This will be incinerated and reduced to ashes. This U-shaped unit has been well equipped since it started managing COVID-19 patients. This man in his mid-20s is just about to undergo dialysis. He came in very sick, but Andrew and team are hopeful. After finishing this ward round in this isolation unit, which is also a critical care unit for people who've been infected with COVID-19, I can tell that a lot has changed. The first time I was in an isolation unit, which was 5 months ago, that was in April, there was a bit of tension and the staff, the healthcare workers there were not very sure about what was happening. But what I have seen now is that people are a bit comfortable with what they are doing in managing COVID-19 patients, and that shows a lot of improvement and a lot of change really that has happened within those 5 months. Change that has partly come from science giving a better understanding of the virus and from the Fourth Estate's relentless follow-up and probing of the duty bearers. The ship is steadying, so to speak, but in our rare view are mistakes that cost Kenyans' lives. Will the deployment of the vaccine be any different?
Receiving the vaccine for the first time in our country, we are very, very grateful for the hard work that the workers in the Ministry of Health are continuing to do to ensure that this vaccine not only arrives in Kenya, but can get to the people who so rightly deserve it.
Njagi's near-death experience became a rebirth for him and his family. He has changed his ways after realizing that he could have lost what he did not know was the most important thing to him, family. Though he is still reeling from the effects of COVID-19.
My breathing into whatever, to be monitored, and the oxygen uptake. Yes, there is a small machine that looks more like a toy that was given to to help me expand the lungs. You realize how important oxygen is, and the way we take it for granted. You know, you wake up breathing and you think like it's normal. You know, you cannot imagine a situation where you will have to be on oxygen that you're paying for. I cannot imagine how I would manage even that common cold now.
This kind of fear reminds us that we aren't done with the pandemic yet, but there is hope that we can survive it. Dr. Mercy Korir, KT News.